Hello everyone. I'd like to welcome you to the webinar. My name is Brian Douglas with Protect Health. We are located in Las Vegas, Nevada, and I really appreciate everybody coming to the webinar today. This is the second webinar we're doing. We had some technical problems with the first one, and we also had way too many people than we thought we were going to have, so questions and everything got a little bit messed up. So we're not going to take questions at the end of this one. I'm going to give you an email address to send your questions to so that we can answer those questions with detail instead of trying to rush through them on the webinar. So I'm going to go ahead and jump right into this and write down your notes of any questions you might have. And at the end, I will give you an email address to send those to, and we will get everything taken care of for you. So first of all, I want to start out by talking to you about what this is. This is a standalone RX plan. It literally does stand alone. It has no real competition yet. I'm sure that at some point in time we will see competition for this program, but right now there isn't any. There is nothing like this plan that currently exists. There are discount plans. This is not a discount plan. There are prescription clubs. That's not what this is. This is a true prescription plan, not insurance, but a plan. A lot of money was spent to make this plan work like insurance without actually being an insurance plan. It keeps regulation down, a lot of extras that didn't have to be there because it's not insurance, and therefore it also kept costs down and commissions high. Those of you on this webinar and the ones that were on the previous live webinar are the first people to be learning about this and the first to be offered this opportunity. We are going to have this opportunity through the end of December as the soft launch. That is the last time we're going to offer the initial opportunity with all of the same bonus and extras that you'll see this one includes. After this, it'll just be a standard appointment. Okay, so first of all, it's a brand new product. It's never been sold in the health insurance market or the Medicare market before. Nothing like this. It's not an actual discount card. It's not a discount plan. It is an actual prescription plan. Like I said, not insurance. It is a point of service product. That means there is no reimbursement, no claim forms. It's a show your card to the pharmacist and get your drugs, or order mail order, give them your number, get your drugs. I'll go into more of that in detail momentarily. It is accepted by almost every pharmacy in the country, and I don't mean that lightly. I do literally mean almost every every pharmacy in the country. We'll talk about that more too. So, who would buy this plan? I mean, that's really where the big question comes in. There is a huge need for this type of solution. First of all, anybody who qualifies can buy this plan. Even a standalone for a child can be purchased. Everybody qualifies. There is, no limits to who can buy the plan as long as they're in the United States, which we'll talk about as well. We find that this is probably going to be beneficial for the underinsured and the uninsured. There are a lot of people in this country still, even with Obamacare, who either didn't or cannot get health insurance on the exchange, can't afford it otherwise, but they need to have prescriptions. So that is a great niche for this product, especially for people who may be in the United States and do not have a permanent resident card or citizenship and cannot get insurance. This is a great alternative for at least that part of their life and getting their prescriptions. This is great for short-term medical plans that don't have any prescription coverage, or some that do that have horrible prescription coverage. It pairs well with ministry shares, defined benefit, and even some ACA plans, especially HSAs, is a good mix and match for this product. The self-employed, small businesses, and group will also be very interested in this product, we believe. I think the self-employed especially will find this to be beneficial. It will allow them to buy lower cost, higher deductible health plans that don't focus on prescription drugs. As we all know, that's really what drives up the cost of healthcare anyway, is the cost of prescription drugs, and this might give them an alternative for that. We also know that Medicare recipients, especially those that are in their coverage gap or their donut hole, may find that this is even more beneficial than the discount they get from the Medicare donut hole. So especially those who may enter their donut hole late in the year and know that they're not going to come out of their donut hole before the end of the year, this is a great option for them. And we are seeing a little bit of interest with veterans and TRICARE. More veterans VA than TRICARE, but still some interest there. So It covers 90% of almost every drug in the United States for $5 or $15 for a 90-day supply. It's literally a $5 payment. It has predictive, transparent pricing. Your consumer and you will know the cost before picking up or receiving meds every time. The formularies are published online publicly. No surprises or having to change medications because their med is not on the list. It is published and available for anybody to look at. It is guaranteed acceptance, no underwriting whatsoever. Anybody who applies gets it. There's no waiting period, no pre-X write-outs, no medication limits. That's a huge benefit. So, there's prescription clubs out there. They all have limits. 2 prescriptions, 3 prescriptions a month, whatever. And discount cards, we all know how those do and don't work in the industry. So, it is a fast electronic application submission that you can do or your client can do. We'll talk more about that too in a second. And it is an immediate use product. So once somebody signs up, their card is presented to them. They'll also get a card in the mail, but they can also print a card and they can go to the pharmacy and pick up their prescriptions right there. Or they can order the prescriptions online and purchase them right there and immediately use their services. We will have English and Spanish materials for the product, brochures. The website is it can be switched to Spanish language on the website, translated. I know that in the future there will be multiple languages available for the website, but for right now that's where we're at. And we will also offer assistance in English and Spanish immediately. You can sell this product year-round. There's no AP or OEP for this product. It is an amazing aftermarket or after open enrollment product to sell. So, who can sell it? Well, first of all, it's not insurance. So anyone can sell the product once they've been trained, and because it's not insurance, you don't have to be licensed to sell it. Anybody in your agency or organization can sell this product. So it makes it really easy to sell. It works amazingly well as a passive marketing campaign, a lead generator, a social media campaign, and because it's not insurance, you can buy it and give it away as a giveaway or a promotion for your company. You can't do that with any insurance product. You can with this. We will provide full training and we will show everybody how to apply and how to sell the product. It's a very fast process and we'll make sure everybody knows how to do that before we throw you to the wolves as it is. All right. So what's covered? That's probably the most important question. First, all acute medications that are on the formulary. Those are immediate drugs needed following a doctor or hospital visit. Antibiotics, muscle relaxers, whatever. That's the first part. That is a formulary in and of itself. And then you have your chronic medications, ongoing drugs taken as maintenance. We always prefer mail order. We'll talk more about that in a sec. But the chronic medications is another formulary of different drugs. Again, all drugs on both of these categories that are in that formulary are $5. It's that simple. There's no pricing to look up. They're $5. We also have a limited number of over-the-counter medications and supplements and vitamins. The cool thing about this is if you're ordering your prescriptions via mail order, you can order your over-the-counter meds at the same time and ship them to you free. And because the rates for the over-the-counter medications are so far below retail, it's amazing how much money somebody can save by doing it that way. And we'll take a little bit of a look at that in just a second. Diabetes medication. Now, this is the third part of the programs. The diabetes meds are not in the first two formularies. The diabetes medications and supplies are separate. But here's what's cool. Diabetics, type 1 and type 2, will have all of their diabetes supplies mailed to them directly to their home, as well as their medications separately delivered to them in their homes. The pharmacy consultant is always available to help with this, so 24 hours a day, 7 days a week, there's a pharmacy consultant available to help with not only the medications for diabetes, but everything else. Somebody's available to talk to you about that 24/7. There is a patient assistance program available. This will help low-income individuals and families, no charge, and they will be able to find brand name drugs for those people. There are so many situations where people don't know that there are programs available to get those expensive drugs. They go to the pharmacy and the pharmacy says, your insurance doesn't cover this, it's going to be $1,000, or people who need pre-authorizations and can't get it because they have to go through some kind of step therapy. There are programs for people like that, and there are also programs for people who are low income to get the drugs that they need, so they don't have to fall back on an inferior drug or not able to take a drug that everybody else with good insurance can take. Even though those drugs aren't part of the formulary, we have the tools there for you to show your client and your consumers you're dealing with how to access those services. Free. We don't charge for that. Those services are free of charge. So, one really important note on this that everybody has been asking. Does it cover narcotics and controlled substances? No. Controlled substances and narcotics require either insurance to be covered or retail rate. So, in October 2021, a lot of local pharmacies all around the country, and some national chains for that matter, started implementing rules that were included in the New York opioid crisis legislation, and they stopped providing many drugs to people with discount cards like ScriptSave and GoodRx. That's important because even though this law only took effect in New York, everybody sees the writing on the wall, and pharmacies all over the country are adopting rules from New York that don't even apply to them yet. You probably cannot today take a GoodRx or ScriptSave card to your local pharmacy and apply it towards narcotics or controlled substances. I know in Nevada you can't do it anywhere. But with this plan, narcotics and controlled substances, while not part of the formulary, the pharmacy, the provider in this case, will usually still provide your consumer, your client, with the network pricing, the negotiated network pricing for controlled substances, for narcotics. And that's because it's not a discount plan. Because this is an actual prescription plan. The pharmacies will still, give them the network pricing or the negotiated network pricing for narcotics and controlled substances. That's something they can't do in any other way. You can't do it with prescription clubs. You can't do it with prescription discount cards. And we all know how it turns out with prescription coverage on most insurance plans. It can be very expensive. So it's a huge option for this plan and a really good selling point for consumers who are in a bind for that reason alone. Okay, so some added benefits. 90% of the most commonly taken medications, like I said, are $5. These are not just back of the shelf drugs. These are the most popular drugs taken in the United States. $5, $15 for 90 days. Every chain pharmacy in the country, Walgreens, Costco, Albertsons, Smith's, Kroger, all of them, Walgreens, CVS, they all take this, and almost every other pharmacy does too. There are very few pharmacies, very few, that do not take this, and I would challenge anybody to find one that doesn't, to be honest with you. So it's not going to be a concern where your client or you are going to have any trouble finding a pharmacy that takes it. They almost all do. The chronic and maintenance drugs are delivered via USPS, post office, free of charge, and that includes the medications for diabetes and the supplies for diabetics. They use USPS because USPS is more secure, usually a mailbox, and it's not subject to packages being stolen. The last thing somebody needs is their drugs being stolen as a package outside their door. The program will work for both patient and physicians to fill the prescriptions for mail order. I don't know, some of you who are doing ACA ran into this year. Many of the insurance companies out there are now requiring all maintenance drugs to be done via mail order, and worse than that, they're requiring that those drugs are done through that insurance company's mail order. And to top it all off, the little cherry on top is that the prescription has to be sent in by the doctor. So that means that your consumers and your customers can't get a prescription from their doctor any longer and turn it in. They have to call the doctor and have the doctor send it in electronically. This plan allows for both, electronically submitted, or the consumer can fax or even call their prescription in to the program and have it filled. And they will contact the doctor if anything needs to be done. So huge benefit there. This is the biggest part of it, especially this program is it's amazing for everybody, but it's even more amazing for diabetics. Diabetics receive the first 90 days of a name brand glucometer, and then test strips, lancets, and diabetes and oral medications, all provided for the first 90 days at no cost. And that includes the top 16 diabetes controlling drugs. Metformin, glipizide, there's a bunch of them. I don't remember all the names, but 16 of them. And those are all covered 100% free for the first 90 days. And then after that, they're on the formulary. $5. $5. It goes on, or 15 for 90 days. So again, amazing for diabetics. And diabetics are on insulin, it's also great for as well. This plan has the lowest non-insurance price available on Novolin vials and flex pens in the United States. Right now, this program has only made a negotiated contract with Novolin. They are working on others. We know Novolin is not the only insulin out there. It is very similar to Humulin and Humalog, but right now the contract is on Novolin. Novolin is the second most commonly prescribed insulin in the country. So here's what's awesome. The Novolin long-acting, moderate-acting, and short-acting insulin, as well as the 70/30 vials, run $19.88. The pen, the Flex pen, is $37.88 per pen. That's Novolin long-acting, short-acting, moderate-acting, and 70/30. 70/30 is usually sets itself apart because it's a little bit more expensive. But when you compare this, we used GoodRx for the comparison. So if you look at Novolin 70/30 for 5 pens at Safeway, it's $288.45. Albertsons, same price. CVS is a little bit less. Target is a little bit less. That's because they're both CVS. But the pricing still comes out to $57 a pen. And we're offering that at $37.88 a pen. Almost $20 difference between the two per pen. That's $120, almost $120 per box. Less than the consumer can get it anywhere. The price for Novolin 70/30 vial, the best price at Walmart is $28. So this plan is $9 less on the vials. So nobody beats this pricing. We have checked, and rechecked, and it is by far the cheapest price on insulin. This is huge. The reason this is good for diabetics also, especially diabetics on Medicare, is because Medicare has a program limit for pens. For example, Novolin 70/30, the maximum that any Medicare recipient can get of Novolin 70/30 is a total of 17 pens per month. Now, I know that seems like a lot, but some people take 100 units every 3 times a day of Novolin 70/30, for example, and they need 22 pens or whatever. This plan can be used for the overage. So they get their Medicare plan to pay for their initial, let's just say 10 pens. Let's say their limit is 15 pens. I'm sorry, and they use the insurance to get their first 15 pens, but they actually need a total of 18. They can buy the other 3 pens on this plan for $37.88 each. Yeah, it's not free, it's not cheap, but if they need the insulin, it's going to be a lot cheaper than buying it retail and considerably less than the prescription savings programs. So you really can't beat it. Okay, so this is the website and how it's going to look. The formularies are here. This is a video, I apologize, so bear with me. The diabetes program is listed here. The medications and supplies are listed here. And the video, I will pause it as we go through. So you just go to medications and supplies, and then go to view all formularies, and then it'll show you all the formularies. The first one is the acute or the immediate formulary, and then the next one is the formulary for the chronic drugs. You can look at some of this list and just look at them. They're the most commonly taken drugs. You'll recognize a lot of these drugs if you sell insurance. These are not, just cheap drugs that are the back of the shelf. These are commonly taken, very popular drugs. It's a huge amount. Stuff that you would see that is $30, $40, $50 per prescription without any type of prescription program. Bronchodilators, antidepressants. Most of the categories are here. Even anti-rejection medication, migraine medication, they're all here. and then you can locate local pharmacies, and you can get the address, make sure they have it in stock. There's a lot of options that'll be on the website. There's the drugs. I apologize. That was the list of drugs for the diabetes program. And I apologize. It's a video, so I can't just stop it, but it's not letting me. But you get the point. So the site will be live. Hopefully by the time you're watching this, the site will be live and you won't have to rely on this. So, okay. So now the important thing is, what does it cost your clients? A single plan is $9.95. A plan plus one is $14.95. A family is $19.95. This is what's cool. Single individual, $9.95. Single plus one. Husband, wife, husband, child, wife, child, 2 children, doesn't matter. One person plus another, $14.95. Family, same household, all related, everybody can be on there. Cousins, nephews, nieces, uncles, aunts. In today's, today's times, a lot of people are doing, especially with the housing prices, are sharing housing. Everybody who's related can be on the prescription card and take advantage of it. So no limit to that, as long as they're in the same household and they are related. So that is an amazing benefit as well. All right. So for you as the broker, commissions, we're still working on the final amounts. I can assure you that the amount of commissions we will release, you will be happy with. It's level for life. So remember, if any of you are not familiar with level for life, that means that you get paid the same in year 1 as you would year 15. So it never goes down. So typically when you have level for life, the commissions are a little bit lower. I'll use dental as an example. We have a dental plan that pays somewhere in the area of 20%, I believe, or 21% level for life. But that means you get 21% forever. When you have other dental plans out there like Delta or some of the others, they give you 30% the first year, but then the second year is 10%, and then years 6 through are like 2%, and then after 10 years, sometimes you lose your residuals. In this case, it's a true residual product, because let's assume, and I think this is probably right about where the commissions are going to be, but let's say that we have your commissions at 30%, and you're going to make 30% of whatever your consumer's paying per month for as long as your consumer has that product. And as you add on new consumers, that continues to go forward. You're going to continue to get that 30% or 25% or whatever the case is forever. So it never goes down as long as your client holds that product. That's where it's so beneficial. But like I said, once we know the commission rates, we will let everybody know what they are. But you will not be disappointed with them. It will be worth your time. You can have multiple downline and agency options, including COAs, which means that you don't pay them a commission, you collect that money and you maybe pay them hourly or whatever. Or you can just add them as an agent and they get paid. It's up to you how you want to do that. I guarantee you that whatever commission we publish, we're going to be the highest. We will pay the highest commission out there. You will not find anybody offering this program at a higher commission rate than we are, at least not after this initial program starts next week. So we will pay the highest commissions, just we will. We also will have you will have co-branded access to a broker page that you can send your clients to sign themselves up. You can publish on the web, you can use in advertising, whatever. Consumers can sign themselves up for this program and you get credit for it. So you do not have to actively sell this program. It can be passively sold through those methods. In addition, all of the pilot brokers that sign up in this first initial soft release of this are going to get a $10 flat bonus forever for every new referring agent that you send us. Now, that doesn't mean agents you put in your downline. You're going to get commission for those. But anybody, like let's say you don't have a downline. You're just an independent agent. You don't do that. You don't run an agency. But you're out to dinner and you're with 5 other agents and you tell them about us. If they use your number when they sign up, for every one of them, you're going to get $10. So again, that's not something you can build a business on, but it's something extra if you don't have an agency that you can use to make a few extra bucks. If you're an agency and you have a downline, you're going to want to add them onto your downline and make commissions, not referral bonuses. And you do not get both. Somebody asked that the last time. So agents will have a technology fee of $1.50 per month that is billed annually. That's all you'll ever pay, but that pays for your website, the technology, the brochures, the materials, everything. That covers it all. That's all you pay. And that is separate from the commission. So, like I said, it's $1.50 a month. It's minimal, and believe me when I tell you, it's worth every dime for what you're going to get. Okay, the best part about that is, at least for those in this pilot initial release, after you sell your first 2 sales of any kind, I'm going to reimburse you that anyway. I'm going to send you back $18 because I think that's the actual amount is 18. I'm going to send you back that $18 to reimburse you for it. So you won't end up paying anything anyway. So if you're serious about selling it, I guess look at it this way: the $18 says you have some skin in the game, and then when you sell your first 2 sales, who cares? I'm going to pay you back anyway, and you know that you're in it for good. So you're gonna start making money. There's going to be a bonus available to only the people in the initial release, so only those that are signed up and ready to go on this initial first release. I will get more information on that later. It's still going through legal, but details soon. It is a bonus based on this program. There are no other fees charged to agents or brokers for this. That's all. There's no other hidden fees, no costs, no nothing. It's just $1.50 a month to use the technology, and that's it. So, and by the way, also, the reimbursement for the $18, that's for you only. If you have a downline of agents, you worry about your agents on that. You want to reimburse them after they make sales or whatever, that's up to you. I'm only reimbursing you as the primary agent. I wanted to make sure that everybody understood that. Okay, the last thing left is to get appointed. To get appointed, you're going to use the following URL: http://appoint.rxamerica.net. Not .com, make sure, because the other one won't take you anywhere. Appoint.rxcareamerica.net. No www, just appoint.rxcareamerica.net. Make sure that when you go to the site that you're not entering it in the Google search. Make sure that you're entering it up here in the address bar. So you'll go to appoint.rxcareamerica.net, and that will take you directly to the page. If you enter it here, it doesn't always work. It doesn't work in this case. So make sure that you're entering it up here in the address bar. That's really important. All right. So once you're in the page, you're going to scroll through the sales agreement. Make sure you read everything here. And at the bottom, you're going to continue. This is your commission level here that everybody is starting at for this first launch of it. So once you hit 100 sales, you automatically get moved up to 30%, and that is the top tier. And then you'll have additional levels beneath you. But right now, you'll have levels beneath you at 25. Okay, so you're going to click to complete, and you're going to fill out your company name here. So if you don't have a company name, you don't need to use one. You can just start with your first name, but whatever you want to do. So let's call ourselves Mr. Insurance, and I'm, let's say I'm Joe Insurance. Your date of birth. All right, and I'm going to use either my personal Social Security number or tax ID for my business. So I'll use my social, United States, street address, and then putting in a fake address here for a reason, which I'll show you in a moment here. When you select the HTML email format, that's the format you're going to get emails from them in. Default language, English or Spanish that you want. Oh, actually, Spanish isn't there yet, so we can change that later. And now, this is the most important part of it. This is going to be your URL. So, for example, in my case, I'm Mr. Insurance, so I might make mine Mr. Insurance. That means when somebody goes to mrinsurance.rxcareamerica.com, they're going to reach my page. So when they go to this page, anything they do is coming to me. I get credit for that. So be creative. You can put anything you want in here, and unless it's taken, there might be some that are taken, but be creative. Your company name, try to keep it short. Your name, whatever you want to do, but don't type the whole URL. Just type the first part of it, just like that right there. and then your email address. And then a password. Well, it does make you put in a strong password, so make sure you do. All right. And then come down here. Now make sure that you scroll all the way to the bottom of the agreement and then click I have read and agree to the terms and policies. Okay, now this is the most important part right here. This is your page, and this is your $1.50 a month technology build for a year. Like I said, this is it. There's no other fees. There's no other anything you have to worry about. Make sure that when you come to do it, you have your credit card information with you, because if you don't, you can't come back here. We have to start all over. We have to clear your account, and you have to start all over. So make sure when you come to do this, you have your credit card number with you and ready to go. Now, once you get to this page and you're going to enter your credit card information, okay, and then you're going to have your information over here on the address. Before you confirm anything or even click on this I agree, click on confirm billing address. If you don't, when you do this, it will fail every time, and then we'll have to clear it and start all over. Once you've done that, make sure that everything is good. Click on the I agree, and then confirm an order. You're done. Once you do that, your page is created the way you wanted to create it with that URL that you specified, and you're done. So if you have any problems while you're in this process, please email me, or if you're in the middle of it and something's wrong, call me. And I will hopefully be able to answer the phone when you call, and I can help guide you through it. But whatever you do, don't stop, leave this page and come back, because then we have to start all over from scratch, and we have to clear everything in the system. So that's easy. That's the gist of it. You're ready to go. All right. So now we've got you appointed. You're good to go. A couple of last things I want to talk about, just as a follow-up of what RX Care America can't do. Probably, we've talked about what it can do. I want to make sure there's no ambiguity on what the program cannot do. First of all, this program is designed to cover the most commonly prescribed drugs. Most brand name drugs or specialty drugs won't fall into this category. Drugs like Enbrel, Farxiga, Eliquis, and other massive expensive drugs will not be in these formularies. That doesn't mean you can't help your client. We'll talk about that in a sec. But remember that even though a lot of times you'll run across those drugs, they're still not the most commonly taken. The reason you run across them so often is because people are trying desperately to find an insurance carrier that will cover those drugs, and that is an issue. So there are still ways you can help them. But keep in mind, those types of drugs are simply not going to be in the formulary, but you can still help them. And one of the ways you can do that is you can go to a prescription manufacturer, prescription coupon. There are prescription discount plans out there. Not discount plans, prescription assistance plans out there that will help people in certain situations. It doesn't even have to necessarily be really low income. They're out there, and we will help you find those if you run across clients like that. It's worth it just to sell the program to them, because they're going to have access to you and all of that information. Okay. So keep in mind, this isn't insurance. It can't replace required drug plans like Medicare Part D. It's not credible coverage. So consumers will still be penalized if they don't purchase a Part D plan. It's really important. It does not, cannot, will not replace Part D. Prescription drug payments can't be coordinated in the United States. It's actually a law. So consumers can only choose one bin per prescription. So in many cases, this plan might be a better choice on one drug, while their insurance may be a better choice on another. That they can do. What they cannot do is utilize this plan in combination with any other card, plan, or insurance and coordinate the benefits on the same drug or the same prescription fill. This makes it easy for your client to determine the best solution, and the pharmacy will always be willing to help, because they can separate the card out between drugs, but not on the same drug. Really important thing to keep in mind. So at this time, the plan is only available to be sold within the United States and outlying territories, and anybody selling it must do so from within the United States. So no out-of-town call, no out-of-the-country call centers. You got to be here in the U.S. to sell it. Real simple. All right, that is it. If anybody has any questions, since this is the last webinar, we are full, and for those of you who are listening to it on demand, obvious reasons, you need to send an email to licensing@protecthealth.com with questions. Real simple. I'll answer quickly. Real simple questions. We can probably get answers to you right away. If not, I will find the answers and get them to you. But there shouldn't be too much left here that isn't understood. So, like I said, any questions, email me, licensing@protecthealth.com. So I want to thank everybody again for coming. And again, appoint.rxcareamerica.net and email questions to licensing@protecthealth.com. Thanks so much, everybody, for coming. I appreciate your time.